Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to continue here with the truths in orthodontics, things that we will put our name on it, that these things are true, and they've been true for years, and they'll be true later on 100 years from now. They're not something that's going to pass away in here. And so we're talking about expansion of the palatal sutures in adults. Now, when the sutures go apart like that, they go this way. And now sometimes after they get past in their 40s or something, you can't get the sutures apart, but you can still expand the arch like that. And we've been able to expand adults into their 80s, and I think I've got one case that went over into 90, but we expanded it. You can make it get bigger without separating the sutures. But I went to New York one time to hear Dr. Donald Timms, I think is an Englishman, who came up with the idea of expanding the arch. And I asked him how old he could separate it. He said about 17 or 18. And I had a whole line of people there to visit with him, and I just, when I said okay, and I just went away. I didn't tell him that I had separated some people in their early 40s and a good many in their 30s. And then if I couldn't separate it, I could expand it. There's a lot of adults that have grown up with allergies and everything, and they breathe through their mouth when they're growing up and everything. And if you breathe through your mouth, your tongue is going to be in the lower arch. And so your upper arch doesn't get the pressure to make it expand as the child gets older. If you take somebody and they're functioning properly, the tongue will expand it inside, and the teeth on anybody end up where the pressure from the tongue side and the pressure from the lips and the cheeks meet in the equal zone in here. That's where the teeth want to go to, and regardless of who you are or what you do, that's where they want to be. And so if you finish them too full or too far back, they have a tendency to relapse as you get older. So let's get in on this case and show this young man. And this was a young man who was in the university, and he was coming in from Denton to get worked on, and we started trying to expand the arch, and it just wasn't going apart. And you feel the pressure until the sutures separate, and then you don't feel any pain at all because there's no nerves in the suture itself. And so I had given up on one young man earlier on, and I wish I had not given up on it, because that guy, I guess, spent the rest of his life with a narrow upper arch and have a breathing problem the rest of his life. Now, if you can go in here and expand the upper arch, you expand the airway, and you help the person in their breathing, and you get it functioning normal like that. Even if you have some allergies, if your airway is really big, it's hard for it to swell up and completely close the gap there. So let's watch this young man. He came in, and he came in one Saturday morning early, and I was working on Saturday back in those days, 1973, and I had cranked on this and cranked, and it just wouldn't go apart. And the whole idea of where the expansion was wrong. I mean, you were trying to separate something out here, and the force is back here around the molars. And if you want to pull something apart, you don't put your hand out there. You come back here, you can pull the thing apart. So I went up there and I looked at him, and he was griping about this thing was hurting, and so the pressure and all this. So I put a little spring in between the upper teeth, in addition to wearing the palatal separator like we normally had on somebody being pushing away around the molars back here at the back. And so here's a little spring. This was 1973. And you take this spring and pull it over here. It's got a lot of kick going out in this direction. And I put that in about 10 o'clock in the morning Saturday, and he was there with his girlfriend, and they went down Fort Worth, and they were window shopping, and his girlfriend looked at him and said, "Hey, your teeth are apart." And he said he looked in a window and the reflection and said I could have put a wooden match between my teeth, and they didn't even know when it went apart like that. And thank goodness he got in, because it would have done the teeth this way. This is not the type of spring you'd want to try to separate with, so now we put them in straight. But here it was, this was 10 a.m. on a Saturday morning. I pulled that spring down, put some legs on it so I could tie it in between the teeth. And now we're pushing the teeth apart. In other words, we're putting the force on the teeth, and then it goes to the bone. Now that we have all these tads and all these screws and everything, put the screw distal to the root of the tooth in here. So, and then put your spring on a wire running between the two tads you've got here. And that puts the force right out here in front, much better than this type of spring. Now the guy came in, and so this is 10 a.m., and he came back in at about 4:30. Thank goodness he got in, because if he had gone further than that, these teeth would have been sticking out like this, right here. So anyway, it separated the pressure, and I learned something there. If you put the force in the front of the mouth and in the back part of the mouth, the vast majority of the bone structure is right between the two teeth, right up here in the front. So go in just distal to your roots, put your tads with a hole in it where you put a spring in that area, and that pushes those teeth apart better. Now, so here it was, and this was the palatal separator we had in there. Working on this, I extracted some teeth on it earlier, and so this went apart. And once it went apart, then we could just go ahead and do what we needed to with the teeth. And we come in and we expand that area, and that pushed the teeth back together, but put the expansions we gained in the laterals. And then go to this in 73, and now we got them in. We got room for the laterals. And I think we took this thing out about that time, and we had these lower arches going to be expanded too. And now we had it about there. Now we've got those teeth in place, and he's not brushing. Looks like he may be smoking something. Now, so anyway, we extracted the bicuspids on the case, but that wasn't the problem in here. So now we line those teeth up like that, and this is, we had him like that. Now we're going to take that palatal separator out and close that other space, and we end up with a young man, and we wore a midline elastic in here, and this is a kind of a class 3 type elastic, pulling the lower jaw back a little bit. And here, these were bands. This is 76. And we finished the young man up, and here are his teeth, 1976. And he got his palate separated, and he was about 20, 2 or 3 years old, I think, when we did this, maybe a little more than that. And after this, we realized we could do this better. And so I've got some people that in their early 40s where we separated the suture. And I had one man that weighed back then, weighed 312 pounds, and I could not separate the suture even though it was in the late 30s. But we just kept expanding, and we pushed the whole palate apart, and the palate just, it kind of drops down as it goes apart, and the bone would look thin in here, so you could stretch the bone structure in the palate and drop it when you go back like that. And so we're able to do more adults now to get that done. You can expand any adult if you just put enough pressure on there, and you can do it with the Big Daddy arch, but you got to learn how to put the torque in those teeth to keep them going out, keep the roots of the teeth going out with the crowns. You have to put your torque in a rectangular arch, and you have to learn how to do that. And I'm afraid that a lot of people do not know how to use that large overlay arch that we call the Big Daddy wire. You've got all the lateral expansion you need in here, but you have to do the torquing with a rectangular wire. So let's get on with this one, and we finish this young man, and then bonded that, closed those up, and here he is, 1976. And I'll be darned if he didn't get a cavity in his teeth. This is 1988. They're still apart. And he had one of his teeth, the filling came out, and he didn't redo it. And I just fussed at him. You need to go have that tooth refilled or crowned or whatever. But this is 1976, and there's 1988. And so this is a case, the first one I was able to get in earlier and separate the teeth, and we realized we could do it. And so we got people in their 30s and some in their early 40s to separate their teeth. And if we couldn't separate them, we could expand them anyway. So I thank you for watching, and I hope you'll join our group and subscribe to our channels. And I thank you, and I will say goodbye. And this is a truth that I was standing on. You can expand the palates on any age. If you just keep the pressure there very gently, you can bring out anybody in their 30s, 40s, 50s, 60s, even way on up there. You can expand it, but you can't separate the sutures on some of the cases even into the 40s. So we can expand the palate, though, even though the suture doesn't come apart like that. Thank you for watching now, and I'll say goodbye until the next video we need to go through. I'll say goodbye.